Don't stop and throw a stick at every dog that barks. There's a lot of noise out there right now. You got to stay focused on what you know is important. In your area of research, there's a lot of barking that go on there. There's a lot of distractions
Mhm.
that go on. I think even what we've talked about with, you can go down rabbit holes in the internet and LinkedIn and, research and things, but you got to always say, hey, pull myself back. I need to be focused on this. Is this stuff really going to help me? Social media will drag you down all kinds of different areas, and you can't be so concerned with everyone's opinion out there. You can't be so concerned with, objections that people bring up, but know where you're going. And when you know where you're going, that dog that barks, you're not going to be so distracted. You're not going to feel like I got to go quiet that dog or throw a stick for him, something like that. You stay focused and realize, hey, that's just some noise that's going on in the background, and I'm still headed towards my goal.
It's bigger than biotech.
All right. Hi,
Perfect.
Dan. Thank you so much for being on this episode with us today. We're very excited to have you on. And without further ado, let's just get right into it. And so, just for context, and so you can introduce yourself, can you walk us through what you do, who you are, and how do you support the biotech ecosystem in LA?
Yeah, no, excellent. First of all, here today, thank you for having me here. I'm always excited to be able to talk with students and other professionals in the biotech and life science industry. Quick synopsis of who I am. So I'm Dan Gober. I'm the executive director for BioCom California. BioCom California is the largest trade and advocacy organization for life science companies. We represent over 1,700 life science companies, really across the US. We're California focused, but we have members in about 42 states. We have international members as well. But we're really focused, our policy work and the different things that we do on the US. So there's three business sections or segments in California, the way we divide it up. San Diego is a segment. It's also a headquarters for BioCom California. The Bay Area is also another segment. And then I have what we call the greater LA area. So it's really everything from Orange County up north to the Bay Area. So, primarily most of our members sit within LA, Ventura, and Orange counties. But five things primarily that we do as an organization for life science companies. One is policy and advocacy. So we do a lot to represent at the federal level, the state level, as well as local policy. So we get involved in county, city policy work, which makes us unique in the fact that a lot of advocacy organizations, really focus on either state or federal levels. There's a number of things that we're doing in that area, and we get into those as we move along. The second area that we work in is workforce development. So we have an institute within BioCom, the BioCom Institute, that focuses on everything from STEAM and STEM education up through, certification programs and different things to make sure we have a workforce that supports the life science industry. A third area is networking. So we do about 150 plus events every year up and down California, a few outside of California as well. They can be small dinners, roundtables, pure networking events, educational events. We do a large global partnering event where we get investors in every year, and so forth. So it's everything from large conferences down to small gatherings. And we think it's important to get the community together. Fourth place is we have a buying group program. So you take that power of representing 1,700 member companies, over 700,000 individual members, and we're able to drive pricing that small startup companies can't get on their own for gases, for insurance products, for FedEx services, different things like that. We've got 32 contracts right now that we manage, in that area. And then the last area is we support our members through capital development. So most life science companies, when they first emerge, will go 10 to 15 years before they start making revenue. So they need grants, non-dilutive sources of funding, introductions to venture capitals, business development folks, investors of all sorts. So we do a lot to connect them and also prepare them for that. So that's really what we do in our capital development programs. That's really what Biocom is and does. A little bit more about myself. So I'm a 30-year plus industry veteran. We'll go through probably a little bit more about my background, but started in large pharma. Spent 17 years at AstraZeneca. I like to joke that I was there before they were AstraZeneca. before the merger, and so forth. Then went to a small startup pharma company, so I've done that work, kind of on the startup. Ultimately, went through the process of a company, running out of money too. So, I feel for a lot of our members. Done a lot of work in market access, commercial strategy, things like that. Just before came over here to BioCom a little over 2 years ago, I was helping emerging companies build their commercial strategy. So that's really what my background is. Born and raised in LA, so I really want to see life science, kind of root and develop more deeply in the Los Angeles marketplace. So that's really what I'm passionate about. That's what attracted me to come over here to Biocom and say, hey, what can we do to support this industry?
Well, first off, thank you for that. That was great context for our listeners, and it really shows how passionate you are about the industry and about LA because you're born and raised here.
Yeah.
And you're definitely a veteran in the industry. You've worked in the industry for so long. And one curiosity I had about this was you've been in industry for so long, but now you're not really considered working inside a biotech company, but are arguably just as impactful. How do you view your role as a connector in this
Mm,
industry, and what is the significance of it?
yeah. Yeah, and that's a great question. First of all, I think being a connector is vitally important. Probably early in my career, I've wanted to ride on your own abilities and be able to drive things forward and just put your own sweat into it and so forth. And as I've been in the industry, you really learn that the more you can connect, the more you can be part of a bigger process, a larger community, the stronger you are. I think that's vital in the development of this industry. Right now we're seeing not only, Biocom being able to connect people, but we see like the county of LA, the city of LA, different cities, even outside of LA, some great things going on in Irvine and Orange County, up in Thousand Oaks and Ventura County, Pasadena's coming along, Culver City. I just had a discussion this morning about really helping build the infrastructure out there and so forth. You need somebody to connect that because when you think about Los Angeles too, the county is comprised of 88 different cities. The city of LA is the largest city in that, but then you go down to Long Beach, Torrance, Pasadena, they start to multiply, and there's a number of places where we need to connect, these cities together. We need to be cohesive in our support of industries that are here, partnering with the LAEDC, with the Department of Economic Opportunity, all those types of things. It's critical to make things happen. So, to your point, I feel like I'm probably more effective and more impactful in the role that I'm doing right now than if I was within an individual company of one type. So that's really why I'm kind of enjoying what I'm doing, first of all, and also feeling like I'm in a good niche to make things happen. And the networking that we do, sometimes you look at it, it's like, well, it's a happy hour, it's a dinner, it's something like that. But boy, connecting with others in your industry, hearing the struggles that they're going through, knowing that you're not alone, especially when you're in a small startup company, you aren't sure whether you're going to make it 4 months from now. You realize other people are going through the same things and connecting and getting connected and being introduced to other people. It's so critical in what we do here in this industry. And LA has kind of isolated itself. We've had some great success stories with Kite, growing out of here, with Amgen growing out of here, but we haven't necessarily seen the community kind of expand out of that. And now you're seeing these larger companies being way more involved in the startup community. You see Amgen involved in LA Best conference that we do every year here. You see, Kite, is now part of Gilead. That's brought Gilead in. You see Takeda having a bigger presence. AstraZeneca is building a flag here. So we've got the large companies also saying, hey, there's interest, there's innovation coming out of LA. So connecting all those pieces together, it's just absolutely critical, and something that we absolutely need to stay focused on.
Definitely. What you're doing is very impactful and can change the future for generations to come.
Yeah,
And
absolutely.
it's not very obvious how you build them because it's a startup in and of itself. Like this is
Yeah.
how. So what do you think makes a regional biotech ecosystem successful, and what is LA doing right?
Yeah. It's funny because as you're saying that, I think about early in my career, when I worked in pharma sales and we would look at hospital systems and how we get into them and stuff. And there was a saying at the time, it's like, if you've seen one hospital system, you've seen one hospital system. And I think we need to think about that a little when we think about the ecosystem in LA. Everyone comes in here and they're like, hey, let's repeat what they did in San Diego. Let's make another Boston here. Well, we aren't that. We're a different ecosystem. We're based off of different academic institutions, different research areas. Geographically, we're spread out a lot more. So it's important just to start thinking about, what do we need and not can we repeat what another ecosystem did. And this comes up all the time with us. So I think we need to be more flexible here. We need to think like I was talking earlier about, you got 88 cities, you've got multiple jurisdictions, you've got multiple counties involved in this, you've got county administrators, you've got city officials, you've got all different folks that'll influence this. And then on top of this, we have some fantastic research. So coming out of UCLA, they're going to build a center of immunology. Coming out of Caltech, there's all kinds of investment. USC is also making investment. And then we've got City of Hope. You got Cedar Sinai. You've got, kind of innovation coming out of Amgen up in Thousand Oaks as well. So each of these ecosystems kind of needs a little bit of a different touch, different flavor. And then, I'm sorry, I should think about Orange County too. And you've got UC Irvine, some fantastic innovation coming out of there. And it's much more med tech focused down there. So I think we're poised for some fantastic innovation, which I say the investment is coming. We're seeing this at UCLA. Just announced, a whole innovation center that they're putting in place. There's some new groundbreaking in and around Pasadena. There's 50 acres that's going back to the city, and there's going to be a dedication to some development there down in Orange County. They continue to develop and have more space. So each of these are going to need, a little something different as far as that goes. And we need to be in there. We need to listen to them. We need to talk to them, and really help build that ecosystem, help support it. So when this innovation comes, we also can make sure that it seeds and it plants here and it grows here and it develops here. And so we've really got to think about ourselves geographically. We've got to think about the types of expertise that's coming out of these different areas. We can't throw one pattern down and think we can just repeat it again and again. You've got to be really well connected, like we talked about earlier. You got to try to understand these different areas and really think about individually, what may be right for Pasadena doesn't mean it's going to be right in Culver City or Torrance or someplace else. It's just different ecosystems. But I think that brings us a strength. Our creativity is going to be much greater coming out of that. The innovation is going to be much more diverse. All of those things I think is going to make this, even better than what we've seen in other ecosystems.
Yeah, that is definitely a very important lesson, and the
Yeah.
key here is not to generalize all biotech ecosystems
Yeah.
as the same thing. They're own unique in their own ways, and that is very important. But within all these biotech ecosystems, there's a lot of support from institutions such as
Mhm.
universities. And I feel like as students, something I wanted to know was how can students contribute to
Mhm.
the development of an ecosystem or early
Yeah.
professionals? How can they help build an ecosystem, contribute
Yeah.
it, contribute to it in a way that's very meaningful?
Yeah, no, I think the students are kind of at the, I don't know if it's the tip of the spear or at the ground roots of what is happening here. When you look at the LA marketplace, a couple things come to mind is, we graduate more PhDs than anywhere else. So our student population's strong. Even if you aren't seeking a PhD, maybe you're working towards a master's, even a bachelor's degree. This industry needs, a diverse workforce, a diverse thought process. So with all of that research, there's innovation that's coming. So, what we can do to support that is, really work with, the tech transfer offices. What are they doing? What are they working on? How can we support them? Can we get them connected to more investors? Is there a difference in the way in which we're going to transfer those ideas out into the marketplace? And then, once they land, a few years ago, we really believed we needed more wet lab space, and now we've developed all these incubators around. So there's plenty of opportunity now for these companies to get into an incubator, work on, refine that product, that innovation, that idea, that tech that they're working on, and move it towards something that's applicable in the marketplace. So, I think that having the incubators connected to the institutions, having the tech offices, but it's also coming out of the fact that it's so important, kind of as a student, to really be thinking about, what if, what if we could do this? What if we could change this in a cell? What if we could, and that creativity is going to spur some innovation that's going to start to change human health. And I think the students are at the crux of what's happening here. And our student population is fantastic here. It's diverse. You're getting a different flavor of it out of Caltech than you will at UCI, and you will, if you're at UCLA or USC. And I just can't emphasize enough how important having a vibrant student body. So we have a couple groups here, BCLA, we have a strong nucleate group. Get involved, get connected, as a student, understand what's going on there. That networking is also really important, but students are vital to what we're building here and sustaining this 10, 20, 30 years from now.
Yeah, definitely. I completely agree with you. But one dilemma as a student is, where do I start? How do I, like, I know
Yeah,
that it is very impactful for students to get involved, but how do they get involved? What are
yeah.
some recommendations you have for them to start getting involved in the ecosystem?
Yeah, no, so I would say a couple of things. I mean, most of your professors, have been through this and had, students where they've launched things. They'll challenge you. They'll get you to think outside the box. So I think, leaning heavily on your professors, in the labs that you work in, in the even the classroom that you're working in, tell them what you want to do, express ideas to them, challenge them, and get involved there. But the second I kind of touched on before, get involved in the ecosystem. Many different groups out there. I had mentioned BCLA, which is, a combination of different students. And they aren't all PhD students, but they're coming out of Caltech, out of USC, UCLA. They have gatherings, get on their mailing list, get to know some people, ask how they get started. A lot of them are ready to get out and launch a company. Where did you start? Ask them. I haven't done this before, so I can't always answer that. But again, I can be that connector. Nucleate's a great program as well. And it's a national program, so you can get connected even beyond the LA ecosystem, if you desire to there. We have a group called Women in Bio that holds different networking events. Even if you're a guy, I go to a lot of these events. They welcome you. You also get exposed to some professionals in the industry, people that are doing manufacturing, that are doing different things, so to expand your horizons by going to some of those things. The LA Best Conference is fantastic. In 2 weeks from now, there's a MedTech conference. If you're working at all in MedTech down in San Diego, even if you can't go to the conference, there's networking events that are around that, different things like that. Take advantage of what is happening in the marketplace and look around. I think that networking and that connecting as a student, it's gonna help spur those ideas and really help you start thinking about, how do I get started in this industry?
Yeah, those are very important next step for students who want to get involved. Communities, right, are a big way.
Yeah,
Nucleate,
oh, absolutely.
BCLA, or local communities if you're outside LA in that case. So any local communities, just find them and get involved. So that,
Yeah,
yeah, that's a great piece of advice. But now moving back to when you were a student, I know you studied economics from Cal
yeah.
State, Long Beach, and what really made me curious was, how did you know early on that you wanted to work in biotech and healthcare?
Yeah.
Or was that something you grew into?
Yeah, no, it's absolutely something I grew into, Herday. I didn't. First of all, I'll say a couple things. Is one, I'm the first college graduate out of my family, so we hear this a lot from minority groups and things like that. But I'm actually the first out of my family. Neither of my parents. I had two older sisters. Neither of them graduated from college, so I was the first one to go in there. So I kind of felt my way around a little bit as I was working on my undergrad degree and trying to figure out what was interesting, and economics was interesting to me. It just, the marketplace, the exchange of free ideas, there's a lot of things that go on in economics that I thought was very interesting. I knew I wanted to be somewhere in business. I kind of was leaning more towards construction and things like that early in my career. I was working a little bit in that field, and things change and you get exposed to different things and so forth. And I had a friend who worked in the pharmaceutical industry and was like, "Hey, have you ever thought about this?" And I was like, at first. And then as I asked more questions and what do they do and what do they make and how does the industry work? And, just again, that curiosity, that connectiveness, that being in a community, it happened later for me. As far as it goes, I was already out there working in the industry when this kind of came about. And I said, "Hey, let me look into this." Pharmaceutical sales jobs offered good pay. You got a company car. There were a lot of nice fringe benefits, and things like that. But I also found out as I got into it, it's like, oh, I love the science. The human body is fascinating in how it works. And even we were selling drugs and products and things, even in the science, you still didn't completely understand how some of this worked. And to me, that was like, wow, there's all this room for innovation, curiosity, to study things at a deeper level. So I just fell in love with it, and kind of hit me later in life. And then you start going, gosh, why didn't I pursue, a PhD? Why didn't I think about medical school? Why did you start questioning all these different things in your own mind and so forth. But I stayed 17 years at AstraZeneca for a reason, moved up and did a number of different things, all really on the commercial side of the business there. But it was fascinating. It was challenging. Everything was new, different days. You got exposed to some thought leaders and some individuals and different things like that. And you got to think about therapeutic areas, disease states. How do you apply to that? How do we change lives? And you start to feel like you're part of a mission, to help change human health. And, so it came along later for me, quite honestly, and, this is why I'm also passionate about STEM and STEAM education. Let's expose people early to this. Let's help them see these things, early on. Let them know there's vital careers. If I was in high school at my time and I was studying biology, I'd be like, what am I going to do with this? So now I know how to dissect a frog, and but you have such a limited mindset unless somebody tries to expand and let you know what does this mean and what kind of careers sit behind that. So, we're doing a lot of that work too, that hopefully will help, get people to think about this earlier, kind of in their educational process.
Yeah, definitely. And I kind of agree with that as well because transparency is the biggest key for inspiration.
Yeah.
Because something I also notice is most students within the health sciences field come in as pre-med, but then end up
Yeah.
dropping out to do something else, which shows that like sometimes there's not the best transparency with what
Yeah.
they can do with their majors in high school or their degrees in university. So yeah, it's very refreshing to see you doing that and believing in that mission. But looking at also more early into your career, what early experiences, mentors, or opportunities helped guide you towards the life sciences space?
Yeah. I think a couple of things I'll just say kind of entrenched, in me, the importance of what we're doing here, is, a few managers that I had early on in the industry talked about the importance of what we're doing, talked about the importance also of investing in other people. Again, I think early in my career it was kind of like, hey, it's about me. I'm going to just bust my butt out here. I'm going to work really hard and so forth. Manager early on was like, hey, you should be mentoring other people. You should be leading teams out here. You should be helping guide people and so forth. And I didn't see it in myself early on, but having somebody else kind of feed into that and let you know, hey, you've got something to offer. You can help develop other people. And then you get involved in it. It's like, wow, developing people, helping people develop their careers, helping them attain goals, helping them solve problems. It's really rewarding. And I didn't see that early in my career until I had a mentor that did that. And then I distinctly remember too having some kind of KOLs that we would work with. So in the pharmaceutical industry, you would bring in different people in therapeutic areas who were subject matter experts. And I'm trying to remember the gentleman's name. We were getting ready to launch a cancer product, and we had him in talking to us about, the disease state and what these patients go through, and really the process of the patient journey and so forth. And somebody in the crowd asked him a question: why'd you get into cancer of all the things? You could have gone OBGYN, you could have gone, a number of different ways. And he looked out and he goes, cancer's so interesting. He's like, every patient's different, he said, and the cancer cells will react differently. He says it was the curiosity that inspired me. He goes, once you get past kind of the morbidity and the mortality of this and so forth, there's no disease state like this. And of course, this is his perspective. This is why, he became a leading oncologist, and a teacher in this area and so forth. But it opens your eyes to think about, what is it about this disease state that's so interesting, you
Yeah.
know? And I heard people talk about in urology, the urologic system, just looking at how the kidneys work and the bladder and everything that connects to it. So I think having people who inspired me both for developing people as well as, hey, the science is interesting, okay? There's some fascinating things about the human anatomy. There's amazing things about how products interact in the human cycle. So, those two areas I think continue to spur that curiosity and drive that passion for what we're doing.
Yeah,
Yeah.
definitely. Those are both very important parts of the industry, and especially for what you do. The science and investing in people is very important. And it really shows the way you're building or helping build the ecosystem in LA, that these two are very important. And on a similar tone, you've led business development for several companies: Eversana, IQVIA, Parexel, AstraZeneca. What personal traits do you think helped you succeed in this high impact world and
Yeah.
role?
Yeah. So, that's interesting. I kind of followed more of a sales path, a business development path, in a great majority of my career. Her day, it's interesting. I think everybody sells. I I've raised four children, and my kids were the best salespeople ever. If they wanted a cookie or an ice cream or something, they knew how to get you to at least consider it, and so forth. But you also learn that salespeople are those connectors. That business development role is a connector role, because you need to understand what's happening within a business and understand what their needs are. And once you kind of put those two things together, it isn't so much business development, it's a lot more of, hey, we're going to help you solve a problem. We're going to help you accomplish a goal. We're going to help you move some things forward in your business plan. And here's some thoughts we have on how to do that. And it could be information. Did a lot in market access work. I was with a group called Health Strategies Group, which ended up being part of Eversana, which is a big conglomerate of companies and so forth out there. But we did some really good work. And it was vital to understand what payers were thinking as you're developing a marketing plan for a product and so forth. And so we could give them insights and help them make these decisions. And so a lot of that, it's interesting, I think just prepared me really for the role that I'm in now. It's like, it's about connecting the dots. It's about understanding what's going on in the marketplace. It's about networking and talking to people, and thinking about them, is what helps you move things forward. Quite honestly, business development can be a very lucrative area too, and once you start to understand the industry and you get well connected and things like that, it helped pay a lot of bills for raising a family and helping kids get through college and things like that too. So there's a very definite financial side of things in that part of things as well. But I think it all comes back to, I think I'm a connector, and I like to know what's going on with people. I'm highly curious. I want to see problems solved, and I'm not always the guy who has the answer, but it's like, hey, can I get you to the answer? Right now it's like, hey, can I help you get in front of the right investor? Can I help you network with somebody else who's going through the same process that you're going through so that you can help, kind of solve the issues you've got going on in your own company and as you're launching a company and, as you're working through different things. And we work on policy issues that are inhibiting or helping educate, policymakers so they understand how important this industry is and the types of jobs we bring and the types of changes we can make to human health. So I think that business development role has really prepared me for where I'm at right now.
Yeah, definitely. And I can really see the value of being a connector in daily life as well. Being curious about people, connecting them to the right people. So just going more into that, digging a bit deeper, how would you say being a connector or the skills you learned in sales help you in your daily life? And how can students kind of implement those lessons that you learned maybe?
Yeah. And I think again, salesmanship is a skill. It's something you work on, just like people can be a very good scientist or a good surgeon or something like that. I think it's a skill that you work on. There's a famous old, salesperson named Zig Ziglar. And, I don't know if you've heard of him, but, his books when I was first in sales were very big and so forth. And he always talked about, hey, help somebody else accomplish a goal. If you help them, you're going to help yourself is what you're going to do. And so sales is a skill that needs to be refined and worked on. It's funny, everyone thinks sales is easy. It's kind of like, the NFL is just starting now, and you watch these guys and you watch these quarterbacks throw balls, and it's like, gosh, when someone's really good, it looks so easy. I watch these pitchers throw right now, 100 miles an hour, and it looks effortless when they throw it. Have you ever tried to throw a baseball? I mean, it's hard. It takes a lot of skill and a lot of training. And I think sales is like that because when you see someone who can just connect the dots for somebody and say, hey, let's do this, okay, buy this product, apply it here. And it's like, oh, so obvious. But someone has worked on that skill along the lines. And so I would say in this industry, don't, discredit the business development people. They're usually very well connected. They have, very good passion about what they're doing. They've learned salesmanship, which is a skill that is developed in depth. And I would say for any of the students out there, it's a great career path. It's something you've got to work on. It's something you've got to refine. It's something you've got to think about all the day, every day. It's something you've got to take classes on. I would practice these things. I can't tell you how many times I've sat in front of a mirror and thought about what am I going to say about a product or a scenario or something like that and watched record yourself, videotape it. There's so many ways to refine that skill, but that's a skill set that has to be worked on. And I think we just like we watch sports and we just take for granted. Patrick Mahomes is going to throw that pass 40 yards down the line. It's going to drop right in the guy's hand. Well, he's worked on that for a long time and he's practiced a lot. So you're just seeing the end result sometimes of a skill that somebody has worked on for a long, long time.
Yeah, with a lot of skills, the hardest part is taking the first step. How would you recommend for students who want to go into sales and at least learn the salesmanship skill? Like, what would you say is the best first step to just start?
Yeah. I think there's two things that I would recommend. One is, what we've talked about is network. Get out there and meet some people who work in this industry. I think salesmanship and really working on that skill as a salesperson in some way. There's a lot of good companies out there that'll give you really good training. I mean, I went through classic pharmaceutical sales training and we refine that every year. So don't discount the fact that, working in a large organization of some type, there's a lot of large medical device companies, pharmaceutical companies, things like that. The skills that they will develop in you, the investment that was made early on in me in training and so forth. I don't feel like I was born a salesperson. I feel like it's a skill that I've worked on for a long, long time. So I would say if you're thinking about that, getting in with an organization that commits a lot of resources to training you to working on those skills. Work on that, give that some time, refine that, think about it, read some books, get connected to different people. There's a million ways. LinkedIn Learning is out there. There's places where you can develop that skill, but that's something you've got to commit to. I think sometimes people think, oh, go do sales for a year or two. Well, no, it takes a lot more skill. You can't just go be a surgeon for a year or two. You've got to put the time and the effort and the training and the understanding into it. And salesmanship's like that too. And I think it's a great career path. You're going to help a lot of people. You're going to hit a lot of frustration. You're going to get discouraged like a lot of things. But perseverance, has to be at the heart and soul of where you're at. And I think you can be very successful at it.
Definitely. Yeah. Yeah. It's definitely skills are not built in one day. They definitely take a lot of
Right.
time. But another important lesson I've learned in my personal experience is that if you don't practice, you can lose it as well. It's
Yeah.
not just once you've done it, you have it forever. It's a lot of maintenance and upkeep. So yeah, it's definitely very important. Another
You
skill
know,
that you did.
if I could just say one thing on that, because people, I think that's key here today is you have to continue to work at it. I mean, if we go back to a sports analogy, where do golfers practice? They practice on the practice range. They put a ball up on a tee. When someone shows up for spring training in baseball, they start by hitting off the tee. They start with some basic fielding. They're going to make sure you're fielding with two hands, sure your body work. You're going to work on your footwork. Boxers do this. And they continue to refine this. You've won the heavyweight title, but you go back to some of those basic skills. The things I've talked about is, look in the mirror, hear yourself, record yourself, ask someone to give you feedback on that. People in sales will roll their eyes at role playing, but oh my gosh, that will refine your skill set and this basic stuff that you work on. I didn't mean to interrupt there, but I think you hit on something that, people who are professionals in every level will go back to that. Physicians go back to training, continuing education in their area. So if you want to be a salesperson, you want to develop that, it's a great career path, but you do need to commit to that and go back to those most basics. Don't neglect those things. They're important.
Definitely. And thank you for emphasizing that. It is very valuable and thank you for bringing it back to the sports analogy so that it's a better connector. So thank you for that and I really appreciate it. But just switching from sales skill to something you mentioned before, helping others.
Yeah.
I was curious about what's one lesson you've learned from helping others that shaped your own approach to
Hmm.
lead.
It's interesting, having done this for 30 years, you sit back and you think about that. And a couple things have happened in my career where I've met people that, you worked with years ago, and they'll say something to you like, hey, you told me that, I just got to stick it out a little bit longer. And that really meant something to me, and I did, and it changed my career path. I think helping others, sometimes, it's kind of like planting your garden. You lay it all out there and you put the seeds down, you water them, and you sit there and you're like, well, I don't know if it's making a difference or not. But you find out later, that there's fruit that comes from that there's something productive that came from that. So I would say as far as helping others, always be willing to help others. If you help others, you're going to help yourself. Think about somebody else's goal and objective. And sometimes it might mean you sacrifice, either closing a sale for yourself, but you think about it, it's like, hey, what I've got here might not be right. I'm going to tell you, down the street, I'm going to send somebody over here because they have something that's a little bit different. You earn that trust, you help somebody, that's going to come back to you. And I think always keeping in mind that if we can help other people, we help build the business, the ecosystem, you build your credibility. And I think your credibility is really highly important, in this industry too. And don't neglect the fact that, you know, people have to see value in you. They've got to trust you. They've got to believe in what you have to say. And then the last thing I'd say about that is always be willing to say, hey, I don't know. I mean, I run into that all the time right now, Herday. People ask me about, do you know the investor in such and space? It's like, I don't, but let me talk to some people. Let me see if I can connect you to somebody that might be able to help you. I get it a lot, and gosh, the technical aspects of a lot of the clinical research and things that are going on is so far beyond me, but it's like, hey, maybe I can connect you to a professor over at UCLA or something that might be, I think is in that area, probably be a good connection. So again, connecting and thinking about solving somebody else's problem is really important. And I think helping others is a big part of that. So, make sure that's important. I think that goes across all aspects of what you're doing.
Right, right, right. Definitely. But I wanted to go more granular because one question I had was it's very situational as well because like it depends on the alignment of goals because like let's say you're working for a big company. As a student, we have plenty of opportunities for to work with a lot of companies and help a lot of different people. But how do we figure out who to help and who not to help? Or when to
Mm,
take an opportunity and versus when do you not take an opportunity? How do you plant the right seed?
yeah. So I think what you're saying is, you can kind of spread your shots a little thin. I think the sooner you can kind of say, hey, there's either a specific therapeutic area I want to focus on. There's an aspect of research that's really important. I really want to get into cell therapy. I really want to get into some type of engineering or something like that. I think staying focused on that then, and making sure that you're making goals to move forward. You do want to help other people, but you also, you can't run around and try to help everything. We can't solve every problem in the world, but if we stay fairly focused on these things. So, I think, thinking about where you want to work is really important. Kind of once I got locked in on the pharmaceutical industry, I got deep into that. Later in my career, I thought some things were really fascinating in medical device. I didn't have the background or the skills to really help, a lot of those companies early on. And still I get questions there, but now I've got the connections, in the right places to help put that together for them. But thinking about where you are, and moving the needle forward in a specific area, I think will be really important, especially students right now who are thinking about an area of research that they want to go into. There is just a wide array of work that's being done out there in lots of different areas. But if you find something that you're passionate about and you want to move that forward, then find the network that's also working in that area, network with them and dig deeper with them and help them solve their problems and so forth. And it's going to come back to you as well in those areas. So, I think the focus is also important a lot, and I probably spend a lot of time on helping others and things like that. I think it's important, but also making sure that, we're not running around trying to solve every problem in the world. There's definitely the need to stay focused on, hey, this is what I do well. You've probably had this experience where you meet somebody and they tell you about the work that they're doing. You're like, oh my gosh, that's so interesting. And they've been working on this for 10 years or something. You're like, oh, I'd love to jump into that. But then you pull yourself back for a second. You're like, I'm not going to be helpful in that area. It's super interesting, and I'm glad we had this discussion. But I'm not the person to jump into that. And I think being able to check yourself a little bit on that sometimes is also important. And there's a balance, and I feel like I'm going back and forth on this because you also, as a student, need to make sure you're exposed to enough things that you can make that decision. I don't know when and where that clicks for everybody. Me, it clicked a little bit later, in my career. Hopefully we can get people exposed to enough things early on that it'll click earlier for them too.
Yeah, 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 definitely. It is a very interesting nuance to this. There's no right answer, honestly.
Yeah.
Everyone figures their own path on their own. There is no right way to do it. So yeah, I mean, it's a very, very important perspective to be able to really see whether you align and always to check yourself and your values if they align with the other person's goals.
Yeah.
Yeah, that's when you feel satisfied and fulfilled, and that's when they also really get the help they need. And that's the right seed sown in your garden. But one question I had for you, and this is more general into the future of your role and the industry in general. If you had to give one piece of advice to someone who wants to work not just in biotech, but shape the industry's future, what would it be?
Yeah, that's a great question. I think probably goes back a little bit to what we've been saying is, find an area that you're passionate about, work on those skills. Don't devalue also that, maybe the therapeutic area you're working in, maybe the lab you're part of, maybe the company that you've attached yourself isn't that shining star. We sometimes want to be part of the greatest. Everybody wants to work at NVIDIA right now because it's like, oh my God, it's cutting edge and so forth. But, I've got a friend who moves dirt for a living, not glamorous, does very well. It's really needed, in certain construction projects and different things like that. You can't just go drop dirt off anywhere. You need to be that connector to different places. Finding your niche and also sticking with it, you're going to develop a deeper skill set. You're going to continue to go back, like we talked about, work on those skills, those early skills, don't neglect the fact that you need to also go back and be hands-on in different things, in order to keep yourself sharp, in an area and staying focused. And what you're going to find over time is you do make a difference. You do make a difference over time. It's hard to see that sometimes when you're in the weeds and you're dug down deep, you're in a lab and you're working on a certain, trying to refine a process or something like that. And it
Mhm.
just feels like you're getting nowhere. And then, finally you realize the perseverance breaks through and you'll start to make a difference. And don't neglect the fact that, it's going to take a career really to see some of this, and you are making an impact by staying focused, by accomplishing a task, by helping others, by, moving a project forward, all those types of things. Eventually you can then say, hey, I was part of, that breakthrough that happened. And they're like, hey, weren't you tempted to go work at Amgen or something? Because I mean, hey, they're a big company. Stay focused on what you're doing. Not that there's anything wrong with working at Amgen. Fantastic company out there, lots of good opportunities, definitely make an impact there. But if you're in a place and there's a need, stay focused on it. Don't let yourself get too, distracted or feeling sometimes like there's some FOMO because, gosh, all my friends are working at way more glorious places and I think they're making more money than I am. I think that their benefits are better. Look at they go on great vacations. They drive nice cars. Stay focused on where you are, and accomplishing your own goals. And I think that's when you're going to make that difference.
Yeah, you highlight a lot of very key human emotions and also very
Yeah.
key lessons. Patience, staying focused, not being too comparative or jealous, because everyone has their own path, and you
Yeah.
may not see the results for yourself right now, but if you keep on working at it and you know you're on the right path, the results will eventually come.
Yeah.
Yeah, that is definitely very insightful lesson. Going on and just staying along the lines of skills, the biotech and pharmaceutical industry is evolving so quickly and so rapidly because the
Yeah.
innovation's happening. What new types of roles or skill sets do you see becoming more important in the next 5 to 10 years?
That's an interesting question. I'm going to shift it a little bit there because I don't know what the exact skill sets are. I'm not deep in the trenches, but I'll tell you a trend that's happening right now that I think is going to really make an impact. And it's something we're calling here at BioCom Converge. So we really think the changes and the next level of impact in changing human health is going to come from a variety of areas. So we don't think it's med device or biotech or classic pharmaceuticals alone, but we think the tech industry, we think that AI is going to come in here. We think that, you're seeing some combinations coming out of skills that were learned in aerospace and engineering and so forth. So this convergence of all these different disciplines is really what's going to make a difference. And so I think there's people out there that are probably working in an engineering platform somewhere that would never think that they're going to impact human health, and they're going to see this convergence of this technology that they're working on, or data sets that they're putting together, or a knowledge transfer that's going to make a difference. So I would say, again, go back to stay in your lane, learn your discipline, dig deep on it. You know, every once in a while you got to step back and look around a little bit. We run a conference every year that's called Converge. We have some Converge meetups and so forth, and we're trying to bring the tech people in. We're trying to bring the biotech leaders in. We're trying to say, hey, think about the things that you're doing out there. How do we cross-pollinate? And I think yeah, I'll give another example of that. UCLA is building this Center of Immunology and Immunotherapy, at the West Side Pavilion. Everybody's been in the news. But a big part of that is, really getting the engineering programs connected in there, making sure that we've got the tech and the high tech that's also part of that, and really developing a center of excellence around that. That's what's going to change. I think that's the future as far as I can see, and I think things are going to start to evolve very quickly in that space, as knowledge continues to gain. The speed of knowledge right now is just astronomical. So that skills are going to be varied, across that, but I think the interconnection of the disciplines is what's going to make the difference.
Definitely, for the listeners listening, this would be a very important pivotal trend that is not too mainstream because not a lot of people
Yeah,
talk about this. I was honestly expecting you to say something along the lines of AI, but this is
yeah,
absolutely great.
yeah,
It's a very profound and very deep futuristic trend that I've also seen with a few companies when I visited a few conferences in LA, such as specifically Varda, which was very
yeah,
interesting, developing drugs in space. I never knew this was a thing and how microgravity could impact drug formulation.
yeah.
Yeah,
It's
my mind was
fascinating.
blown.
Yeah,
Yeah, so it's
yeah,
very, very, very cool to see. And so thank you for that insight. I hope it really helps or inspires a student listening to this right now.
yeah, yeah.
Uh, I just have two final ending questions for you that we ask all of our guests. What is a favorite source of healthcare industry related information for you?
There's a publication that comes out every week called Big Four Bio. It'll give you an idea of different things that are happening in the biotech industry. There's a publication group called STAT also that does a lot as far as the biotech world and things like that. I'll tell you, Herday, a place where I dig in and I spend probably more time sometimes than I think I should is in LinkedIn. I think LinkedIn's a fantastic community. You see things that people are doing. You see conferences you've never heard of. People will send things to you through that. There's also learning processes in LinkedIn. It's funny, I've been in LinkedIn for, I don't know, 15 to 20 years or something now. I've got close to 6,000 connections on that. But it never ceases to amaze me how many people are out there and how much information is going on and the diversity of what's happening in the world. It's like, you think you know everything and then you realize how little you know. But I would say, have a couple publications you look at on a regular basis. I think that's a good thing to do, and maybe find something that's a little more specialized to your area of research or the therapeutic area that you're digging into. And then I would say the community part of it, and LinkedIn's a great place to have kind of that online community, a place you can check in on a daily basis and see what's happening, and so forth as well.
Definitely. Two very valuable resources,
Yeah.
industry specific, niche specific publications and LinkedIn. So
Yeah.
100%. And my final question to you for this episode is, what is a wise quote that has stuck with you over the years?
Yeah, that's interesting because yeah, I think what comes to mind is there was a guy named Dr. Walter Martin. I used to listen to him on the radio a lot. He would say, "Don't stop and throw a stick at every dog that barks." And I think it applies to a lot of what we've talked about today. It's kind of like, hey, there's a lot of noise out there right now. You got to stay focused on what you know is important, in your area of research and so forth. And, there's a lot of barking that go on there. There's a lot of distractions. that go on. I think even what we've talked about with, you can go down rabbit holes in the internet and LinkedIn and, research and things, but you got to always say, hey, pull myself back. I need to be focused on this. Is this stuff really going to help me? Social media will drag you down all kinds of different areas, and you can't be so concerned with everyone's opinion out there. You can't be so concerned with, objections that people bring up, but know where you're going. And when you know where you're going, that dog that barks, you're not going to be so distracted. You're not going to feel like I got to go quiet that dog or throw a stick for him or something like that. You stay focused and realize, hey, that's just some noise that's going on in the background, and I'm still headed towards my goal.
Yeah. Wow. That is a very good quote. I will be using that somewhere, I'm sure. It's great. Thank you so much for your time, Dan.
Absolutely.
This was absolutely great and a very insightful conversation, and I'm sure our listeners took something away from this episode for sure, because there's so many
Thank you.
interesting insights, trends, lessons you talked about, and I appreciate it a lot. Thank you so much.
Yeah. No, thanks for having me. It's been a pleasure talking to you. I know our paths will cross sometime in the future here soon.
It's bigger than biotech.